the COVID vaccine, the COVID disease, epidemiology, etc., and they have all been advisors to me and to this process. We're here with Dr. Paige, and we're also here with many members of the business community as well as labor. My top priority since coming into office in November has been the lives and livelihoods of our residents. We have used a data-driven, truly collaborative approach to working together to address this pandemic, this crisis, the public health response, the economic response, the humane response. We've worked with public health experts like Dr. Peter Paige, and we've worked with our residents to reinforce the essential public health protections that were needed to help us keep everybody safe. We've worked so hard over this past year, and so many have sacrificed so much to get us through this pandemic year and to get us to where we are today. And the positivity rate of the virus transmission has been steadily trending downward from the peaks that we experienced last year, and the vaccine availability has steadily increased, with more and more people having access. So much so that 72% of those over age 65 have now been vaccinated in Miami-Dade County. Truly a great, great milestone. And as we've worked to aggressively expand eligibility for the vaccine, we now have passed 800,000 residents who have received at least one dose, myself included. So this is truly a great, great piece of news for us, a great piece of comfort that we're moving ahead. And today is the day that we have all been waiting for, the day when, regardless of age, 16 and up, everyone is eligible to get the vaccine. So I'm very grateful that the governor heeded the calls from local mayors like myself, Orlando, and that we've been able to expand eligibility. And this truly is a turning point for us in addressing this disease. Our single best tool, of course, is this vaccine. It's the only thing that will end this pandemic so that we can get back to normal and rebuilding our economy. And just Friday, the CDC announced, finally, that it is safe to travel for those who've been vaccinated without getting tested or quarantining, and as long as they continue to wear masks, socially distance, and wash hands frequently. And by the way, that includes me, and I'll be visiting my grandchildren the end of this month. I can't wait. This is extremely encouraging news, and it is the latest sign that the vaccine is truly on the path behind us, and we're on the path to returning to normal and our everyday activities that we've missed so much, including restoring our tourism and our overall hospitality economy that has been in a tailspin. So over the last few weeks, I have worked closely with our Chief Medical Officer, Dr. Peter Paige, and our experts to revise and update the COVID guidelines that have kept us all safe during this past year, to determine the best path forward with the current data and current medical information, public health and economic recovery being the focus point. And so today I'm announcing updated, streamlined COVID safety guidelines that prioritize essential protocols we must continue to follow to prevent the spread of the disease. We must continue to wear our masks, socially distance, and disinfect. And if you're sick, you must stay home, of course. And as well, we are announcing that the curfew will be lifted next Monday, April 12th. In close consultation with Dr. Paige and my senior leadership team, we developed these new guidelines based on the current status of the COVID response, the availability of the vaccine, the aggressive campaign that we're mounting. We considered all of the available data, including the 14-day positivity rate and also hospitalization from COVID and death rates. So these have all declined significantly as vaccinations for the most vulnerable has expanded and our overall vaccination program has progressed. So Dr. Paige is here and he'll be speaking specifically to those indicators and the data. You'll hear from him in a minute. But continuing to wear the mask and to get vaccinated, those are the two most important things that we all must do to slow the spread of this disease and put the pandemic behind us. And if we do those two things, we will beat this. We will beat this pandemic. We will get back to normal, and we will be able to begin building back our economy as well. We can and we will. So Miami-Dade County will continue to work closely with the business community, including the restaurant, hotel owners, employees who are represented here today and who stand in unity with us on these guidelines. We will continue to distribute resources and information to the hospitality sector employees and to our visitors, and to answer key questions and dispel the myths about the vaccine. And by the way, vaccine hesitancy is on the decline. More and more people are willing to take the shot. We have our outreach team, Vax Now, that stands for Vaccine Accessibility for Community Safety, VACS Now. They're going door to door to schedule people for appointments, to tell them about the safety of the vaccine, to help them to get the shot. And they have already knocked on over 10,000 doors. Yep. And overall, we've seen promising signs nationwide about the vaccine confidence, as I said, and more are willing to get vaccinated. So as we continue to make progress, we want to be sure that everybody knows that this vaccine is safe and effective, and it's truly our best shot to return to normal and put the pandemic behind us. So the county will be working with our community in the weeks ahead to ensure that everyone will have access to accurate, reliable information and access to the vaccine. So to our residents who are listening, I urge you, take the shot. Do it for yourselves, for your loved ones, for your community. It is our only path out of this. And once you get the vaccine, pay it forward. Make sure everybody knows that you have taken the shot. Make sure that your friends and families know how important it is and how safe it is and how important it is for them to continue to wear their masks, socially distance, and disinfect. And you can learn about all of the locations, the availability on our one-stop shop website, miamidade.gov/vaccine. In Spanish, vacuna, in Haitian Creole, vaccin. So please check it out. And to our businesses who have helped us get here, who've done everything to make sure that we could keep our community safe and get back on track, thank you so very, very much for the sacrifices that you've made to protect your customers, to protect your workers, and to protect the community at large. We're going to continue to partner with you to get this done and restore our economy fully, better than ever. And let us stand together, as we have done for the last year, and truly the end is in sight. Y ahora en español. Hoy es el día que hemos estado esperando. Todos los adultos pueden ahora recibir la vacuna hasta el 16 años de edad. En realidad, la vacuna es nuestra mejor herramienta para poner fin a la pandemia y a construir totalmente nuestra economía. Hoy estamos dando a conocer las directrices actualizadas de seguridad antes el COVID que priorizan protocolos esenciales, usar máscaras, mantener la distancia social y desinfectarse las manos. Seguir usando máscaras y vacunarse son las dos medidas más importantes para disminuir la propagación y eventualmente superar la pandemia. A nuestros residentes, por favor, los animo a que se vacunan. Una vez que se vacunan, asegúrense de comentarlos a sus amigos y familiares la importancia que tiene y ayúdenlos a hacer un plan para vacunarse. Debemos mantenernos unidos como lo hemos hecho en el pasado año para juntos llegar a la meta. Muchas gracias a todos. All right. Ahora en creol. Okay. Estamos anunciando hoy que comenzando el lunes adelante vamos a levantar toque de queda porque estamos con los datos mejorando y estamos listos con las protecciones que tenemos, seguir adelante más abierto, pero tenemos que seguir usando las precauciones, las mascarillas, la distancia social y desinfección. Gracias.
Bonsoir, nom c'est Cassandra Ana, directrice d'affaires haïtienne. Je dis à moi très content d'annoncer que quel que soit l'âge, tout le monde qui prend le vaccin. Ça c'est un gros accomplissement. Le vaccin est la plus bonne option pour nous battre Covid là, pour nous capables de commencer à rebâtir l'économie nous. Je dis à annoncer plus d'instructions pour nous stopper Covid là. Trempli, continuez à mettre masque, distance sociale et puis laver main. Ça c'est la meilleure façon pour nous battre Covid là. Après au fin prendre vaccin, assurez les amis et famille ou prendre vaccin tout. Aidez à faire un plan pour être capable de recevoir vaccin. On nous camper ensemble, même si nous sommes campés pendant l'année qui sont passées. Enfin, nous avons annoncé que curfew dans toute Miami-Dade qui apprend la lever lundi prochain 12 avril. Encore m'a dit ça. Curfew dans toute Miami-Dade là apprend lever lundi prochain 12 avril. Merci.
And next we'll hear from Dr. Peter Paige.
Good afternoon, everyone. Thanks for joining us for this, pretty exciting news. I wanted to run through a little bit of some of the data that we track on a regular basis, give you a little bit of an idea of what is helping us make some of these decisions. And we'll talk a little bit about the vaccines, and then I'll turn it over to the next speaker. One of the things that we do track, as the mayor referenced, are positivity rates. These are really tests across the county, and the percentage of them that come out positive for the first time in a patient. And what we're seeing most recently is a 14-day average of about 6.41%. That's roughly flat to a 14-day average from a month ago, but as the mayor referenced, is decreasing from the peaks that we saw, a few months ago. So we did expect a little bit of an increase in the positivity rate because the positivity rate really reflects community transmission. And obviously with all the activity we have down in Miami over the winter and over spring break and all the travel, we thought we'd get a little bump, but it really hasn't been as bad as we thought it could have been. So that's also a positive. When we look at the inpatient positive hospitalizations, this is a really important number for us to track in the healthcare world. If you look at, we track on a daily basis the number of patients that are hospitalized that have COVID positive status, and our most recent numbers are 518 across the county. 404 of those are not in critical care units, and 114 are in critical care units. As a point of reference, if you go back a month ago, our inpatient hospitalizations were 597, and 418 of those were not in critical care, and 179 were in critical care units across the county. When you look at the numbers, we've gone from 597 down to 518 overall, and our critical care numbers, probably even more impressive, have dropped from 179 to 114. Very favorable trend as it relates to the significance of the illness and the hospitalization rates that we're seeing in the pandemic. We also have seen a downward trend, especially since January, the end of January, in our death rates. Again, another piece of positive information. And when we look at it, we always try to figure out why is this happening? Why are we going in such a favorable direction? Obviously, a big answer is the vaccines. The vaccines are up, operational. The rollout's been very good. As the mayor referenced, we've given over 800,000 shots, and it continues to go strong. there's no question that's had a significant impact on the severity of illness of COVID in Miami-Dade County. I think that the other big point, the prioritization of the high-risk population, greater than 65-year-olds, those with comorbidities that are particularly vulnerable, frontline healthcare workers, nursing home residents and staff, as well as first responders. It's really been a very successful vaccine rollout for the county, which has also been very favorable. I know there's been a lot of discussion about the curfew. The curfew was one tool that we used to help try to curb and mitigate the spread of the virus. And the curfew was effective. It did help decrease, one potential area of exposure and transmission. But again, it was only one factor that we had implemented in a strategy overall for the pandemic. I think that obviously the impact the vaccines are having, obviously also we're seeing the CDC lighten some of their restrictions. Those all are favorable and obviously support the decision to remove the curfew at this point. I think the last thing I would mention, about the vaccines, there are two big components to the vaccination program. One is we have to have the vaccines. The other is people need to take them. So I would just encourage everyone to continue to promote vaccination, and when you get an opportunity to get a vaccine, please get it. The final piece, we have to remain vigilant. This pandemic's not over. We're in a much better place than we were, but we have to continue to enforce masking, social distancing, hand hygiene, avoiding large groups and celebrations, get outside in this kind of weather as opposed to indoors. And obviously, if you're sick, stay home, get tested, and follow the appropriate quarantining and isolation recommendations from the CDC. Thank you very much.
Thank you, Dr. Paige. Next up is Dave Grubman, founder and owner of Groot Hospitality.
Hey guys, today is actually a wonderful day for us, especially for my sector. We've gone through lots of trials and tribulations, and this just shows why we're in the greatest city ever. The fact that we were able to roll out vaccines so quickly and act so quickly to get us back open. It's amazing, and thank you so much. As someone that's vaccinated, I just want to really encourage my counterparts to get your staff vaccinated. Make sure you're telling everyone that you're vaccinated, and that's the way we're going to stay open. So for me, guys, just keep pushing the vaccinations, and let's get Miami back. Thank you, Mayor. Great day. Yep. Sorry? Oh, I'm sorry. No.
Él dijo que es un día maravilloso, que vivimos en la ciudad y el condado mejor del mundo, que hemos mejorizado con el acceso a la vacuna y que es tan importante tomar la vacuna que él ya tomó, y es importante decir a todos los trabajadores que tomen también la vacuna. Okay.
Thanks, Dave. Thanks, Mayor. And next we'll hear from Julie Grimes, managing partner of the Hilton Bentley Hotel.
Thank you. Well, this really is an exciting day. We're just delighted and thrilled to work with Mayor Levine, Cava, and her team. The collaboration with the business community has just been outstanding. We, of course, all welcome the re-energization of our hospitality industry. I'm a hotelier, so I can tell you we're very, very enthusiastic about seeing the new streamlined protocols and being part of making that happen. I would just like to remind everybody, as everybody's saying here today, the obvious, but let's not ever forget it. Keep your mask on until we are out of this. Please get vaccinated. I encourage employers to really work with their team members and encourage their staff and team members to get vaccinated. Now that it's readily available, we're so incredibly lucky in this country to have the vaccine. Every other country is just wishing they could be in our position. So let's lead the way and show the way to the rest of the world. Get vaccinated, get your arms ready, get your team members and everybody out there, your colleagues, your friends, and thank you once again to the mayor and our outstanding team for moving us forward.
Next are the owners of Rio Cristal, Elizabeth Acosta Ana and Emisel Ana.
Hello, my name is Elizabeth Acosta Ana and my husband Emisel Ana, and we're the owners of Rio Cristal. If you know a little bit about last year when everything shut down, we almost had to close our doors. And due to the overwhelming response of our customers and the community, we were able to stay open. And the same way that I, feel so grateful that, we didn't have to close, it's the same way that I feel about getting vaccinated. I was a little hesitant, but the way I see it is like, how can I not? When the community showed up for me, I need to show up for them. And he was vaccinated yesterday, and I was, I'll be vaccinated tomorrow. So encourage the community. It is a great day. It is the fact that we have it accessible to us. We should absolutely take advantage of it. So again, thank you to the community for the support that they have given us and making it, so that we're still open and being able to serve everybody in Miami.
Thank you.
Yeah. Mi nombre es Elizabeth Acosta Ana y este es mi esposo Emisel Ana. Somos de Río Cristal. El año pasado, no sé si ustedes saben, pero casi tuve que cerrar la puerta cuando la pandemia hizo que todo tuviera que cerrar. Y la comunidad y los clientes que tenemos pudieron apoyarnos en la forma que pudimos mantener la puerta abierta, y en la misma forma pienso que la vacuna, aunque yo al principio estuve un poco reticente a si le iba a recibir o no, pienso que igual que la comunidad nos apoyó a nosotros, debemos de devolver el apoyo por vacunarnos para que podamos seguir abiertos y normalizar ya lo que hemos, tú sabes, en la vida.
¿Qué significa para ustedes la noticia de que a partir del próximo lunes ya no va a haber oferta y van a tener que volver a la puerta?
Obviamente bien agradecido porque es una oportunidad de poder dar servicio más tiempo y yo creo que eso se siente que ya todo se está normalizando un poco otra vez. So, agradecida.
Yeah.
Okay. Thank you. Como lo dije, con el apoyo de los clientes, si las personas salen o ordenan a comer, eso nos ayuda a seguir en negocio, y no es lo mismo que era antes, pero para lo que tenemos ahora yo pienso que es todo lo que necesitamos, que es el apoyo de la comunidad. Okay. ¿Eh? Sí, pero aquí estamos. So. Okay.
We have just 2 more speakers and then we'll take more questions.
Gracias.
Thank you. Thank you. And next we'll hear from Wilkinson Cejor, the owner of Chef Creole.
I'd like to say good morning to everybody, and I would like to also say thank you to the mayor and the direction that she has been giving us, because being a small business owner, we've stayed open from the time that this whole COVID thing started. And it would not have been possible if the mayor did not make certain reliefs and concessions, especially to one of our airport locations. And it was very, very important, when you don't get the relief and you have a business in the airport, it can be catastrophic. And of course, it could be a domino effect to our other 6 locations. So I would like to thank the mayor very, very much for giving us the opportunity. And everybody pulling in together, we're able to stay open, not even lay off not one employee. As a matter of fact, we're looking for employees as we speak at the moment. So I urge everybody to please get vaccinated, of course, and obviously the protocols that have been put in place have been working. So it's not like, it's a guessing game. It works. And I like to say it in Creole, my native language, tout moun. M'dap di magistrat merci en pile pour tout ça li fait pour communauté a direction li te bay nous toujours ouvri, et m'dap di tout moun vraiment n'a nage pour nous sortir te pou jwen nou chans vaksine ko a vwèman pou nou ka toujou avanse nan tout sa nap fè. Again, Mayor, thank you very much on behalf of Chef Creole and the Haitian community.
And our final speaker is Nancy Torre, an employee at HMS Host at the airport and member of Unite Here.
Hello, everybody. Good afternoon. My name is Nancy Torre. I work for Miami International Airport for HMS Host for 26 years. I work with food and beverage concessionary. I am member to Hospitality Workers Union, Unite Here, Local 355. We are thankful to the mayor for beginning thankful to hospitality workers and make sure they are able to return safely our job. We're glad the hospitality is started to coming back. We are not out to the wood yet. Almost all of us will lay off and peak on the pandemic, and majority as have still not coming back to work. Everyone who wasn't laid off due to COVID-19 should be available to back to their job, tourists coming back. As hospitality work, we are frontline workers. We interact with thousands of guests each day, and we need to ensure that we keep safe. We need everyone to get vaccine and keep wearing their mask. Hospitality jobs are the engine in the county's economy. Work will continue to need help. We are confident the mayor is the right track and Unite Here, and happy to support her decision today. Buenas tardes. Yo soy Nancy Torre, trabajo en el aeropuerto por 26 años. Todos necesitamos trabajar. Fuimos despedidos debido al COVID. Han sido llamados algunos, pero necesitamos regresar a trabajar todos. Nosotros somos las personas que damos la cara a la gente en el aeropuerto, al turismo. Entonces necesitamos trabajar seguros, todos vacunados y manteniendo nuestra distancia y teniendo las máscaras puestas. Es hora de que nos llamen. Necesitamos estar todos seguros para poder sacar adelante esta ciudad. Gracias.
Perfecto, Nancy. Bueno, un momentito.
¿Qué porcentaje de trabajadores han estado trabajando durante esta pandemia y están esperando que van a regresar?
Bueno, básicamente diría yo el 95% fuimos despedidos. Porque ahora mismo están trabajando, por decirte, en un restaurante trabajaban 8 empleados, una cafetería para decirlo más pequeño, y solo están haciendo el trabajo con 2 personas. Entonces necesitamos, ¿qué pasa con las otras 6? No estamos ahí. Entonces ellos dicen que es por seguridad, no por seguridad. Tenemos que sacar el país, tenemos que vacunarnos todos, tenemos que ser prioridad nosotros también, porque damos la cara a mucha gente.
¿Cuántos del sindicato están desempleados?
Muchos. Somos más del 90%. Somos demasiados restaurantes, hoteles. Somos las personas que damos servicio a todo ese turismo que viene a este país. En número no te podría decir, pero es más del 90%. Yes.
Gracias, Nancy. Muy amable, muy amable.
Thank you so much.
Okay.
You better say your closing remarks and then.
Do I have closing
No,
remarks?
wait,
Do I- I just want to close by acknowledging the incredible support of the business community in getting us through this pandemic. You had several speakers. We're also here represented the Greater Convention and Visitors Bureau, Bill Talbot. We have the Greater Miami Chamber of Commerce, Spencer Pylant. We have Wendy Kalergis from the Hotel Association. So they're all here standing in unity. They have worked so hard tirelessly to get us through this point and to help save lives and livelihoods. So now I'll be happy to take some questions.
I'm just curious, you talk about the positivity rate and the hospitalization rate. Were those, you talk about critical factors that you consider with respect to that?
Yes, so the fact that we had greatly diminished the hospital census, the deaths, and the ICU beds is an indication that those who are getting sick are less sick. because we essentially believe because of the high vaccination rate. So it's really the vaccinations that are taking us out of the hole here. And so we're going to continue to double down, make sure that we can vaccinate everybody possible, and we're aggressively pursuing that goal. Yeah, go to you.
The curfew being lifted, the violations from the past couple weeks, those who were cited, is that enforceable? What's going to happen to those violators?
Well, you know, essentially we've given warnings. That's essentially what we've done. And so I know many jurisdictions have been advising, counseling, and businesses have shut if they were staying open past the curfew. So really we're focused on the path forward. We're focused on making sure that everybody follows the precautions that will keep everyone safe, even as they open longer or start earlier.
So no fines, just warnings?
I'm sorry?
So just a warning, no fine, nothing like that?
You know, I would have to go back to see exactly whether there were any. Of course, we're not collecting fines in this time period. So again, the important part of this is not to penalize, but to move forward, taking the necessary precautions.
Apart from the curfew, what about new guidelines in terms of capacity or?
Yes. Yes, so we have the new guidelines are being issued today. They will go into effect tomorrow. Just as one example, child care centers will be able to double their capacity. This is very critical for the child care centers that have really been struggling to stay open, and we know that we need child care for people to go to work. Senior centers will be able to open. You'll be able to use water fountains if certain protections are taken. You'll be able to be outside with your mask in hand, but not wearing it if you're 10 feet or more apart, and several other things like that. Okay. Bueno, uno de los cambios que comienzan mañana, los sitios para los niños, cuidar niños, pueden doblar la capacidad, como CDC dice, 3 pies, era 6, y también los centros de los ancianos pueden reunirse ahora. En el ambiente natural puede quedar distancia de 10 pies o más y no usar la mascarilla, pero tenerlo por si acaso alguien viene más cerca, y usar water fountain, no sé cómo decir. Fuente de agua. Fuentes de agua estarán abiertos y ellos pueden proteger, hacer la desinfección necesaria. Entonces hay muchos y es mucho más fácil leerlo, mucho más corto, y espero que todos van a leer.
Mayor, last month you talked about targeting a 5.5% positivity rate in order to lift the curfew. It's kind of stuck above 6%.
Yes.
There's some concerning numbers, particularly among young people in the last few weeks.
Yes.
Are you concerned with lifting the curfew that, obviously starting today, younger people are eligible, but if they're still going out,
Yes.
clubs and bars, that
Yes. Well, we're very encouraged that the hospitalization and death rate has gone down, and that's as a consequence of the older people and more vulnerable being vaccinated. But we know young people also must be vaccinated because they may still transmit, and it's really their responsibility to step up and get that done. Now that it is open, there should be no barriers to vaccine. So we looked at a confluence of circumstances and decided that they were heading in the right direction.
But maybe with respect to the 5.5 rate that you talked about in previous memos, so I gather you've taken in other considerations?
Correct. We looked at the totality of the circumstances, and with the advent of the vaccine, we did not know at the time how readily available the vaccine would become and that it would be open to people of all ages.
¿Y los restaurantes van a seguir con la misma capacidad o van a aumentar?
Todavía tenemos la capacidad en los restaurantes igual como antes, pero no es tan detallado de cuándo y cómo limpiar las cosas. Estamos con las precauciones, pero ellos van a tener que implementarlo y proteger los clientes. Okay. It's a great day. Hooray. Everybody's happy, right? And now all of our reporters can get vaccinated too.
Okay.